It's back. The runny noses, the itchy eyes, and the difficulty breathing are just a few of the things that let us know spring has definitely arrived. Seasonal allergies affect nearly 18% of Canadians, according to the Government of Canada. And that means there are just over 6 million people walking amongst us who may not be feeling their best. Further, for those living with asthma, seasonal allergies only intensify their symptoms. Dr. Christine Palmay is joining me today as part of our ongoing series with caretoknow.ca to address how we can push back on the impact of pollen and other allergens to live our best life. Welcome back, Christine.
Thank you so much again, Candace, for having me.
So, I am feeling for people who are walking around right now, just feeling the full effect of pollen and all these other allergens floating in the air. So, let's talk about how we can make life better for those 6 million. That's a really big number, isn't it?
That's a huge number, and in fact, probably 5 to 10 visits in my office on a daily basis. Quite
Wow.
significant.
So what are some of the most common allergens then?
So, I sort of talk about allergies as a reaction of immune system. Our immune system is a wonderful thing, but it's not perfect, and sometimes it inappropriately reacts. So, environmental triggers like grass, weeds, pollen, hay fever, depending on the season, these result in an immune cascade. And, patients complain of cough, sneezing, itchy eyes, shortness of breath. That really, really do affect quality of life. These aren't insignificant. It's not just take an over the counter medication and go. It affects school, your ability to function, your ability to sleep, cognition. So should not be underestimated.
Do you think people confuse though allergies and asthma? Like they might have asthma, but they think it's allergies?
Yeah, I mean, that's an excellent question, and they're certainly interconnected, but they're not necessarily causative. Asthma, in its purest definition, is chronic, lifelong inflammation of the airways. There are triggers to asthma, which are often environmental allergies, and the risk of having environmental allergies is higher if you have asthma. So, just to complicate things further, oftentimes when people have seasonal allergies, they experience asthma like symptoms. And in those cases, I may prescribe a short term use of an inhaler that would be used for a classic asthma patient. But when you take away the trigger, the asthma goes away. So, those patients don't necessarily have asthma in the chronic sense. They experience asthmatic like symptoms during their allergy flare. Uh, a lot of words saying that they're interrelated and they can worsen each other.
Can you develop asthma at any age? I always thought it was a younger person, like it was developed in your childhood. Can you develop it later in life?
Much like information is evolving moment to moment, absolutely. I'm having a lot of adults, particularly now with an insult to the immune system, with the various viruses that are flowing around, developing chronic asthma. And certainly other things like exposure to pollution, smoking, etc., can increase your risk. And then you have your cohort of patients who have childhood asthma and grow out of it. So it's not static, it forever evolves. And certainly, if you're having symptoms, you should speak to your primary care physician.
Okay. Well, how can we protect ourselves then from triggers that affect our respiratory systems and function?
Great question. So there's basic DIY things. Use a HEPA air filter in your air conditioning unit, vacuum cleaners, etc., to move allergens. Avoid carpets. Avoid heavy, heavy drapes. Wearing a mask during peak allergy season, and you're just paying homage to your immune system, making sure that you're sleeping, exercising, getting good nutrition. I always say that ginger is my best friend. Making sure that you're actually feeding a healthy base for your immune system, and then managing stress. Stress is obviously something that is almost unmanageable now, 3 years into what I call the plague slash COVID, but really, really emphasizing that overall health will reduce inflammation and help protect against symptoms.
Are there any new treatments for allergies and asthma? And how do they improve patient outcomes if there is new treatments?
There are absolutely new treatments. So there's not only new oral treatments against allergies that are safer and come with less side effects. There are new inhalers on board as well. It really is a respiratory renaissance in terms of many therapeutics. But most importantly, there are new guidelines. And now the guidelines encourage primary care providers like myself to strive for symptom-free control, not just better, but symptom free control. And that's a huge call to action that encompasses not only the DIY measures that we discussed, but also the pharmacotherapy measures that are new. So please reach out to your primary care providers and make sure you educate yourself.
All right. Well, I'm feeling for these millions of people walking around in misery. So caretoknow.ca has lots of information on this very topic. So where can people go to find out more?
Absolutely. On the top of education, being informed is empowerment. Caretoknow.ca is the website. Log on, subscribe. As you mentioned, it's free, and it's not only free, but it's hassle free. You'll instantaneously get emails delivered to your account, and Instagram handle is care to know underscore.
Wonderful. Thank you so much. We'll see you next month where we're talking about menopause. And I don't think we have enough time for that.
Probably not, but we'll try.